My name is Vikram Patel. I am a psychiatrist and subsequently I trained as a public health researcher. I am a founder of the organization called Sangath. Sangath was founded just around 12 years ago, in 1996, by 7 individuals, including myself. It was founded with a vision really of primarily promoting child development. We now work in a range of different settings, such as, for example, primary health centers, schools, in preschool creches run by the government's child nutrition program. And secondly, we look beyond childhood. We now work across the life course. We work with adolescents and youth. That's the age group for which we have received support from the MacArthur Foundation. We also work with adults. And we work in a wide range of health issues, but primarily we're focused on child development, youth health, and mental health. The first is our very strong multidisciplinary approach to health. We strongly believe that health is not a medical issue and that the best way to address health concerns, particularly of young people, is by working across professional disciplines. The second important innovation is that we take risks with the delivery system. We do not believe that a system that relies solely or mainly on highly qualified professionals is either affordable or feasible in a country like India. The risk we take then is to utilize relatively less skilled individuals, for example teachers, provide them with additional training and then place them in institutions like schools to promote young people's health. The third important innovation is that we do not deal with health in isolation from other important concerns for young people, and of course the main other concern is education and livelihood. So we see health as a bedfellow of education and livelihood, and that any program that seeks to improve health must in fact also address educational needs and ultimately careers and livelihoods. And lastly is our great emphasis on evidence. We select interventions based on the best evidence available, and where evidence isn't available, we see it as our mandate to generate evidence. About 1/3 of India's population is in this age group of adolescents or youth. The main challenges, it seems to me, for this group is actually education and livelihood. There's a very high degree of school leaving before completion of school. And we think actually that completing school is probably the most powerful health intervention of all, because we have very good evidence that those who complete school have much better health outcomes in later life than those who haven't. So for us actually, and this goes back to my earlier point, that we cannot separate health from the social context of health, and education is a very powerful context. Well, for Sangath, and I'm sure I speak for most non-governmental organizations when I say this, success means where we are no longer needed. Success for us means that the work that we do has been scaled up through the national policy system. In other words, it's become part of routine government policy and practice in public healthcare or educational institutions. In other words, the work we do is no longer required for us to do it.